Codependency series of tapes of Dr. Nair's presentation of emotional anesthetics.
Find out, but it's interesting. The thing is, your body carries a lot of the feelings of infancy and childhood. Whether you were held with shame, or whether you were held with terror, or whether you were not held at all, or the holding consisted of somebody feeling you up for their own sexual excitement, or smashing you across the face because of their frustration. Your body carries that. In the tics in people's faces, in the posture of their spine, in the way that they will walk, the body carries these messages. Body work, massage, being held both by loved ones and people at some distance, neutral touching, all this is important. When people walk around without a sense of excitement and pride in their bodies, they carry the shame. A lot of people, for example, they may do everything else, but they will not do body work. And it is for these people that body work is absolutely essential. Even if you attend all the meetings, if you don't do body work, in a sense, you carry the shame and the pain and the fear in your body. As long as you can feel safe, that you're not going to be touched. And if touch is somehow going to either drive you crazy, or start getting sexually excited, or start building up with anxiety, or start getting paranoid and start trashing around and become violent, if you're holding on to these feelings, in a sense, you are still not in recovery. For many people, especially with eating disorders, self-mutilation problems, addiction problems of different kinds, body work is absolutely essential. Because we're talking of bright people who have tried many other things and are trying many other things, but seem not to be able to connect. And for such people, body work may make the difference between recovery and not recovering, or going from recovery to growth, because even though we don't talk about growth that much, it's really a continuum. You don't say, boy, I'm saved, I have not had a drink for all these years. I mean, there is more to life than not being an alcoholic or not wanting to die or not cutting on oneself, growth is what gets to. And for people that feel that, yes, I feel good about not having a drink for all these years, I feel good that I'm not in a codependent relationship, there is more. I mean, there is more for all of us, everyone has the capacity to be able to dream and make their dreams come true. There isn't someone that is, once you begin to see the world in a truly different way and recognize a sense of self-love, no goal that someone else can achieve needs to be taken away from you. Okay, so body work may not only liberate you from addictive problems, but may take you on to a better recognition of self-love and power about oneself. I feel body work is absolutely essential for sexual addiction problems, eating disorder problems, self-mutilation problems, but all addiction problems in general, where there is a deep-seated sense of needing to placate the body with something from the outside, whether it's sex or drugs or whatever. Okay, it increases self-awareness. Very often, in a very concrete manner, people will start remembering things when body work is done. Memories, flashbacks, all these kind of things can begin to come inside the person's mind, and then they start making the connections which were blocked for years and years. Self-soothing. Self-soothing is many things. I mean, for people that have not known what it is to feel calm, they have to make active efforts to try to learn how to find calmness within themselves. The capacity to be alone without being lonely is an absolutely essential one. The capacity to be alone without having to take drugs, alcohol, or destructive habits. If you have to be alone, either you have to get drunk, or you have to watch a porno film, or you got to have somebody making out with you, or you got to work like a slave for someone. You got to be able to tolerate being alone and feeling good about oneself, and that is what training oneself with self-soothing is very, very important towards that. Body work again helps a person get to that, making your body feel good by experiencing good sensation in one's body. One begins to feel at a very primitive level a certain sense of calmness. If you have never come to that point, then you need to begin to work towards getting that point. Self-soothing can also be done by exercise. Okay? For people that feel tremendously agitated at the thought of being touched, exercise may be a good way of beginning self-soothing. I had many people tell me that the reason why I don't want to do yoga and relaxation is I start getting crazy when I put myself in this lotus posture. The thing is, one doesn't have to sit in a lotus posture to meditate. You know, you can meditate in the bus, or you can meditate on your toilet. I mean, I got a story about that. But anyway, but one can relax by exercising. Exercising puts oneself in a state of mind where you can be clear, calm, and alert, and do some really good thinking and make some really good connections, which for people that carry a lot of fright, they may not be able to while they're just sitting. Okay. Exercise, very, very important, especially for people with, again, one can exercise in an addictive manner, and that needs to be guarded against. Exercise in a relaxing manner, exercise for about 20 minutes to a half hour every day that stimulates the autonomic nervous system, can empower people, they can make them feel stronger, can treat their depression, can fill the sense of emptiness within themselves, and can treat anxiety problems. It is both empowering, it is also soothing. And dealing with grief and rage through the multiple things, like the groups, like journaling. But coming in touch with one's pain is very, very important. The pain may be rage, the pain may be sadness, but one needs to look behind every addict and codependent. There is both grief and rage, as I stated earlier, and it's not just admitting to it, but working through it. It's not just visiting that pain, but staying connected to it. It is not just recognizing that one has been traumatized by the out-of-control, hateful behavior of a parent, but staying connected to those feelings until you have come to a point of truly forgiving yourself. And you're truly forgiven when you are able to love yourself, when you don't have migraine headaches every day, even though you tell yourself everything is fine, but you have migraine headaches, when your body feels good, when you feel unanxious, when you start feeling creative. That's the time you know you love yourself, when the world begins to feel like a warm and nice place, and people don't seem to be threatening, when you can connect to other people's love without feeling threatened, when love goes from feeling like a web or a net around oneself or a wall around oneself to one which is refreshing and one which lightens oneself. Okay, that's when you know that you are healed. It's not just saying, I'm over the rage because now I'm attending AA, I don't drink, and I've given I have forgiven my parents that did all these things to me, or I have forgiven my stepfather that incested me, or whatever. But to really stay connected, to really work through it, to feel the feelings. It's not just thinking the thoughts, but feeling the feelings. And oftentimes, unless body work and 12-step work and being in these trauma-specific meetings where you actually see people break down and feel, it is just like going to a horror film. You may have the mental pictures, but you're not connected to the feelings. You have not broken down. You have not experienced the rage. So both rage and grief, sadness and anger has to be felt. One has to go from rage to anger. Rage is a out-of-control, pervasive feeling that often doesn't have a name and a face. Anger is when you recognize where it comes from. You name names, people, things, and you gotta, instead of something that consumes you and doesn't have a direction and comes out like a volcano, you direct it towards specific people. Maybe people that are alive, maybe people that are dead, but it's pointed. It has a name and a face, and it is something that can be worked through. In the same way, hopelessness has to be converted to sadness, and sadness has to have specific, and sadness and grief has to have specific things. I felt grief because of this. I felt grief when I lost my parents as parents, and they became John and Cindy or whatever, because once a child loses parents, as in the parents through separations, death, molestation, all of these things, because when a male parent abuses a child, a female child or a male child, sexually, he is no longer a parent. The parent, in a sense, is destroyed. Okay? They have been given up on. There is a death of a parent. Okay? And all of these things, there is sadness over having lost a childhood. Okay? It's absolutely important. The last thing that I have put down in the way of recovery is confrontation. And again, to me, confrontation is at many levels. One is confronting the things that have happened in your life. It starts out with confronting yourself that there is a problem. It then goes on to confronting yourself with all the other problems that have led up to the problem. And finally on to confronting people that have caused those wounds. Your work is not complete until you have confronted people that have caused you those wounds. So either within your own mind, in allowing yourself to experience the anger and writing, maybe writing letters of confrontation. In your own mind, when you give yourself permission to express your rage in whatever way you need to express your rage, whether it is hurting them in your mind, allowing yourself to think homicidal thoughts about them, thoughts that you have stifled, allowing yourself to curse them, do anything that it takes, and allow yourself to do that and forgive yourself those kind of feelings. See, we have been taught that we're supposed to love and respect our parents, and if you have spent your entire life feeling hateful towards them because you have felt murderous towards them, you have to confront them with the fact that yes, there was a time in my life when it felt just to feel like I wanted to kill you. Okay, my hate was justified. You got to confront. That is the confrontation that has to take place. And there may be parents that are no longer alive, but you have to confront in your own mind that this was needed, this was necessary. In every situation where actual confrontation can take place, actual confrontation needs to take place. When confrontation doesn't take place, one is in denial, one is in dissociation. I had a patient that many months into recovery, she chose to go move in back with her father that had incested her. And immediately she started developing eating disorder problems. Because she was, in a sense, going back to denial, dissociation, and reawakening all methods of dealing with the shame and the sense of guilt and self-hate by going into anorexia nervosa. Now, forgiveness doesn't take place unless one has forgiven oneself. I'm going to stop now, and I'll take what about chemical addictions, what drugs do to the brain, medical questions, or things relating to child abuse.
One of the things that I would like to say just before we do this, knowing that some of you might come from the 12-step philosophy and Dr. Nair doesn't, and maybe we've offended any of you, I have 10 years of 12 steps. And there was a book put out called Language of the Heart. And the founder of the 12-step program, his name is Bill Wilson. And at 23 years of sobriety, he made the statement that it has taken him 23 years to go from the depths of depression, and he's always wondered why the 12 steps haven't worked. And when I read this some time ago, it was like, I got to calm down. Because I knew, and many people do know, that even though this man gave up alcohol, he died of sexual addict. And what he has then said at 23 years of sobriety, I have finally realized that I am a codependent, that I am dependent upon other people, places, and things. I know in my own recovery that I looked at addictions like an umbrella, that they were the things that kept from me from the pain that I didn't want to feel. And the reality of my recovery is that my recovery did not really begin until I began to experience and remember the pain that I went through. So many of them don't remember what happened in this life. But there's a lot of things that you can do to remember your childhood. I mean, mine is a blank all the time. But I just wanted to put that out there as well, just in case that there was any misconceptions. And I saw a hand in there.
Yes.
Okay, I have a problem with migraines. And you made a statement about not using drugs to numb yourself out from pain, not feeling pain. But the problem with the migraine physically is that when blood changes flow, it's pushing on sleep center, cognitive center, so I just become non-functional at that point. So whether I take medication or not, I'm not going to function while I'm in that pain. And I've been able to, whether I'm in the pain or not, go back and keep working on whatever issue there is. But I can't keep working on it while I'm in it because it's just too severe.
I think the important thing with migraine headaches is that you got to connect to what was going on in your mind, what the situation was when it happened. The risk is that too many people with migraine headaches will take medications and never connect to what triggered off the migraine headaches. Was it a bad dream? Was it a relationship? What is happening? That the soul searching that needs to take place. I'll give an example. Poor sleep will trigger off migraine headaches. So you take some medication and the migraine headache goes away. But you never think why I had poor sleep. Every emotional, behavioral, physical problem is time for inventory taking. Everything that happens in one's life, especially when it comes to basic functions like I don't feel hungry. I got to know why I don't feel hungry. It's important. Every physical pain, every emotional feeling, every behavior needs to be assessed. And among people for whom reality has been distorted and love and hate are all confused, and caretaking and loss of boundaries and this kind of confusion of infancy and childhood, this lies, this web of lies that has been created, every situation has to be assessed. Okay? Because what you may be thinking or feeling at one level may be completely different. It's important to connect to why the migraine happened. The thing is, it's nice to think that migraines are triggered off by coffee and chocolates, but the bottom line is they're not. It's not. Migraines are not just triggered off by coffee and cigarettes and all these things. I mean, these are obviously, migraines are triggered off by many, many things. Some we know. There's probably a few thousand that we don't. Okay, but certainly stress is one of them. You got to look. See, when you have migraine headaches, that means your autonomic nervous system, the system that controls the blood vessels that go into spasms, okay, is out of whack. You have dysautonomia. That means your autonomic nervous system is unstable and overloaded. Because you're not thinking through and feeling through things, too much activity is taking place in the lower levels, not in the less clever parts, but in the more gut-related parts, which control the autonomic nervous system. Your breathing, your heart, your bladder, your gut, the little brain that goes on the outside of the blood vessels that causes them to. So it suggests that there is internal tension. An example is the same thing as why should people that are in the early 20s that have hypertension, you got to do more than just take antihypertensives. Too many people that have hypertension at an early age stop with taking antihypertensives because they fix the effect, but they never get to the cause. So when the medication taking stops you from doing soul searching and inventory taking, then it becomes dangerous. It blindfolds you from looking at why. Every effort must be made to recognize what brought on the migraine, what is behind. You can make a safe assumption that if you have migraine headaches, there is some major turbulence, some major loss, some major fear, some major terror, some major sadness that has not been dealt with. That deep inside your inner child is in some kind of agony that has not been addressed, and you are not calm. Maybe you are calm here, but you're not calm deep inside. Have I addressed your question?
Yeah, I think what you're saying, as long as medication doesn't interfere with the process of feeling, you're okay.
Yeah, let me kind of add on to that. And I don't want you to go. I was asked something earlier today by somebody that's going to write a little part of that's going to publish a part of a book that I've written. So I need to clarify that. If you're doing everything else to be in recovery, you're okay to take medication. It's when you are not doing the things to be in recovery that it is dangerous to take medications. And that's the same thing with taking antidepressants. If I'm sure that a person is doing everything that needs to be in recovery, including body work and exercise and things like that, which may be part of, for a person, for some people, exercise may be an absolutely essential part of recovery. They may have great intellectualized jobs with computers and stuff like that. They're correct about their food, they attend the right meetings, but they don't exercise. They're kind of stuck there. And that exercise may be that one thing that they need to be able to get over that. So if they're practicing the entire program and they're truly honest with themselves, then it's okay to give yourself symptomatic relief to get to the next point. But more often, because it is in the nature of people that are given to quick fixes and a fright and a fear of soul searching, that the tendency to use medications is there. Yes?
Are you saying that prior to every migraine is triggered by some kind of an emotional response to something?
Either something that is happening right then or something that has happened in the night before, that there is some unresolved trauma, some unresolved pain, something. It may not have anything to do with what is there right now. It may have to do a lot with things that have happened in the past.
But something immediately prior to triggered something about something in your past.
And you might not know what that is. It's like, I had a woman in my office the other day, and I was doing an intake with her, and all of a sudden I said the word beaten. And she went like this. And it's like, I said, are you okay? It's like, oh, I have this tremendous pain. And then it went away. And I said, were you ever beaten? And immediately, like, she clutched it. And that's what I'm saying, the body remembers the pain. That's what we're saying.
So,
Does that make sense?
Yeah, you got to look at the migraine as an unresolved symptom of some childhood trauma. Everything in your present life may be perfect, except that you have terrible migraines. And then when you begin to tease out that terrible migraine, then you find out that there is some major trauma, that no matter everything is fine in your life right now, there's some major trauma in your life that triggers off these migraine headaches.
I have another question.
Okay, why don't I take her question first, too? Yes. Well, I think sleep disorders are...
Specifically, I know I was abused. I know I was sexually abused. I know people came in my room at night. I still wake up at between 3 and 3:30 every day, every morning, when I'm in a place that other people are there. In hotels, motels, people in the next room, in a hospital. I'm in a hospital program now. I'm sleeping outside the hospital with friends. Whenever people are in the house or in the area around me, even though I know I was abused, I still wake up every morning between 3 and 3:30. Is that going to go away?
It's going to go away. It's going to go away. But the signatures on your... You got to look at the mechanism of sleep, like actually something that's there physically. It's got connections and stuff like that. You got to look at it like a little apparatus in your brain. There's software and there's hardware, all of which really takes place in stages of infancy. And when something has been disturbed for a long time, okay, either because it was not formed right or was not allowed to be formed right, and people woke you up for their own excitement, and you had to that you were not allowed to sleep, or you were woken up at 3 o'clock in the morning, when it's been etched so deeply, it takes a long time for it to regain and become well-rounded. And that's the reason why I tell people it's very, very important to restabilize sleeping, waking patterns. Very, very important. For people that have grown up in relatively nurturing and safe environments, sleep is like a healing mother. You know, it is something that in a very real sense allows us to heal our brains, dry up our tears, make this world that is sometimes unpredictable a safe place. We test run the excitement and the fears of the day and create millions of little buds in our brain to allow us to handle those situations the next day. It's like we test run our brains and situations in our life constantly. Our brain works on healing itself at night, okay, through the balance of REM sleep and non-REM sleep and things like that. When there is intense emotional pain, terror, trauma, deprivation, frightening sounds, frightening physical activities, in infancy, during before the age of 3, the brain's capacity to do all of this is not there. So REM, non-REM sleep, REM sleep, non-REM sleep disturbances, this architecture of sleep gets disturbed. And that is something you find universally in people that come from a background of dysfunctional family environment, addictions, things like that. And oftentimes that's the reason. I can't go to sleep until I have a drink. You know, I mean, this is like a common thing. You use external agents to self-soothe. Used to be like the only question that I used to be running a unit of about 70 state hospital patients when I was in Boston, and a lot of times that was the only question I'd want to ask, like if they've slept well, if they haven't slept well, you know, because you don't get much of a chance when you got to deal with 80 people on a unit and you got 4 hours to work with it. But it kind of tells you where a person is. And good sleep, in my opinion, is when you wake up feeling rested. It's not so much whether you have slept 14 hours or whether you sleep 5 hours. Each person's sleep needs vary. In older age, people need a little less sleep. When they're younger, they need... So it varies between 5 hours and 8 to 9 hours, depending upon how old you are. Yes?
Regarding my mother, who's been diagnosed with Alzheimer's disease, and all she talks about is she never said she was an abused child. Now that she has this disease, she is like bringing back her childhood, and there's a lot of anger there. And that anger, she's striking it out. Why is that? And there's not, all she talks about now is her hard life, her childhood. We never knew that she'd been abused until now. Why is that?
See, the thing is, your higher, your intellectual power. You know, the intellectual power is like it's like a double-edged weapon. You can have a lot of hate and feelings of self-hate and hate towards the others hidden away with rationalizations, and your own, you become because of your drive and because of your intellectual brightness, you're able to give your life a semblance of love, a semblance of pride, all of these things. But deep inside, the feelings are there. And then sometimes when the intellectual framework begins to break down, as in with Alzheimer's disease, as in with people that suffer little strokes and stuff like that. So a lot of people that seem to be very well adjusted until their brain function deteriorates in older age, then they start getting paranoid and suicidal and depressed and self-hateful, because now they're not able to dam the flood of their pushed down feelings with their intellect. See, the thing is, when you have been brought up in love and you have a feeling of real safety within you, then even as we get older and we start getting deaf and we start getting blind, and what we read we can't connect because our brains can't reckon all these things as well as we could, the deep-seated sense of feeling safe with people remains. And that's the difference between why some people get paranoid and hateful as they get older, and other people, even though they may be neurologically impaired and blind and things like that, feel very safe in this world. And the reason why some people have to wind up in locked units in state hospitals as they get older, and other people are able to live in the warmth of their children and grandchildren. Yes?
I have a question about, like you talked about in alcohol, how sometimes there is damage to the brain as a result. What about in long-standing eating disorders? all the different types of anorexia, bulimia, just all the different aspects over years and years. Have you heard anything that might cause some type of brain damage? I've noticed, I've started taking this Prozac medication, the minimum dose necessary, 20 milligrams, and sometimes I have difficulty pulling the words together. It might also have to do with the anxiety that builds up. I was wondering if there could be any connection to that, because I know often the thinking is fuzzy and unclear.
So did you have the fuzziness of, the question is, does eating disorders cause fuzziness of thinking and brain changes? So did you have the fuzziness before you started taking the Prozac?
It's almost like, I don't remember.
The thing is, with any eating disorder, you can have fuzziness of the brain. Yes, that's true. You can have fuzziness of the brain in the sense that you're thinking, you're feeling, your capacity to put stuff together, do intellectual tasks, operate a computer, not recognize whether you should laugh or you should yell at someone, all of that stuff. Feelings and all of these things are affected because in anorexia, there are many, many reasons. Because there is, first of all, there is starvation, okay? There is starvation, and starvation changes your metabolism and often puts poisonous substances because of the breakdown of proteins into your brain. And that will cause a person to get anything from depression to anxiety to confusion to psychosis, okay? So we know for a fact that anorexia, because of malnutrition, both immediate and long-term, will cause brain changes and there will be an organic brain disorder. We don't have enough evidence on whether bulimia in itself causes brain changes that will cause cognitive impairment and things like that, as in the fuzziness that you talked about. But it is very likely. On the whole, there are brain changes with both kinds of eating disorders, but it appears to be at different levels. There seems